Hello, everyone. If you're over 60 and have ever felt confused by blood pressure numbers, then this video is for you. Have you ever measured your blood pressure at home and seen a reading like 145/85, then wondered whether that's considered high normal or whether you need to start taking medication? As a doctor who has worked for decades with older adults, I've come to realize treating high blood pressure isn't always just about getting the numbers as low as possible, especially after the age of 60. Today, I'd like to walk with you through a simple yet incredibly important question. When is it truly necessary to treat high blood pressure in older adults? Hello, everyone. There's something I believe all of us, especially after the age of 50, have asked ourselves at some point or at least seen in a health checkup report. What is a healthy blood pressure? Then your doctor says, that's a little high. But when you get home, your neighbor tells you, at our age, it's normal for blood pressure to be a bit higher. And in the end, you wonder, what's actually correct? I meet a lot of patients like this, especially those over 60 who are still active, walking every morning, eating well. But when they measure their blood pressure, it jumps to 140, even 150, and they get anxious. One patient, Mr. Robert, once asked me, Doctor, I feel completely fine. So why does this number make me so worried? I don't blame him at all. Because in today's world, we've become obsessed with numbers. We forget that health is more than dry data on a screen. It's how we live, how we feel, and how our body responds. Here's what I want you to understand. Blood pressure in older adults is not the same as blood pressure in your 30s or 40s. Over time, our blood vessels, like old roads, lose elasticity. The vessel walls become thicker, stiffer. So a slight increase in blood pressure, especially the systolic number, the top one, is almost a natural part of aging. Many large medical studies, including recommendations from the American Heart Association (AHA) and the National Institutes of Health (NIH), have shown that for people over 60, a blood pressure below 150/90 mmHg may still be safe as long as there are no serious symptoms or underlying conditions. I remember an older lady who once came in worried that she had high blood pressure. She had read somewhere that it must be under 120/80 to be considered normal. I asked her, do you feel dizzy? No. Do you get tired when walking? Not at all. I smiled and said, then you're living just fine with those numbers. We don't need to force our hearts to live like they did at 30. What we need is to understand it, listen to it, and walk with it gently. That said, I'm not saying that high blood pressure is harmless. Absolutely not. It can be dangerous if we don't manage it or misunderstand it. Chronic, uncontrolled high blood pressure over many years is one of the leading causes of stroke, heart attack, heart failure, kidney failure. But here's the key point. Not everyone with high blood pressure needs medication immediately, and not every reading of 140 should cause panic. Doctors will always look at the full picture: your age, your overall condition, your lifestyle, other health issues, and even your quality of life. Let me ask you, when was the last time you measured your blood pressure? Do you remember the numbers? And more importantly, how did your body feel at that moment? Because to me, the numbers are only part of the story. The rest, and often the most important part, is how you're actually living. See you in the next part, where I'll talk about when is it truly necessary to treat high blood pressure and when is it okay to wait. If you found this section helpful, please share it with your friends and loved ones, especially to those over 50, because heart health is a lifelong journey, not just a matter of numbers. In the previous section, I shared that blood pressure, especially after the age of 60, doesn't always need to be immediately pushed down with medication. But I know the question many of you still carry is, so when do I actually need treatment for high blood pressure? A valid question, and one that can't be answered with just a single number. Let me paint a picture for you. You walk into a clinic, the doctor measures your blood pressure. The machine shows 145/88. You're not on any medication. You have no headaches, no dizziness. You still go for a walk every morning, eat a balanced diet, sleep well. So, do you need to take medication? The answer is maybe not yet, but you do need to monitor it closely. I once treated a 72-year-old gentleman, a retired veteran. His blood pressure hovered around 145/85 for years. At each checkup, he would ask, do I need to start medication, doctor? And I would say, if you don't have diabetes, kidney disease, or a history of stroke, then at your age, this level is still safe. We agreed to monitor it together every 3 months. He kept a healthy diet, walked every afternoon, cut back on salt, and over 2 years, his blood pressure remained stable without any medication. However, there are certain moments when treatment becomes necessary. When are those moments? If your systolic pressure, the top number consistently stays above 150 mmHg for several days, if you have any underlying conditions like diabetes, chronic kidney disease, a history of stroke, or heart attack, if you experience dangerous symptoms such as persistent headaches, dizziness, fatigue, chest tightness, shortness of breath. I had a patient, her name was Linda, 68 years old. She didn't smoke or drink, but had a family history of stroke. At her last visit, her blood pressure reached 162/95. Even though she had no noticeable symptoms, we decided to start her on a low-dose medication combined with lifestyle changes. Because with high-risk individuals, we simply can't afford to wait. High blood pressure doesn't cause immediate pain, but it silently damages your blood vessels like water slowly eroding a riverbank. No one sees it until the bank collapses. You see, the most important thing isn't whether you're taking medication or not. It's about learning to listen to your body and understanding that starting treatment early can be a wise, proactive choice, not a sign of weakness. So if you measure your blood pressure and see a number over 140, don't panic, but also don't ignore it. Track it regularly, take notes, and work with your doctor to make the best decision based on your body, your age, and your life. There's one question I hear more than any other from patients over 60. Doctor, can I live healthily and keep my blood pressure stable without depending on medication for the rest of my life? And I understand truly. No one wants to depend on pills every day. No one wants to wake up each morning and see a tablet as a reminder that their body is getting weaker. But my answer is always this. Yes, it's possible, but you have to take charge. Once I asked one of my 67-year-old patients, his name is Arthur, do you know why your blood pressure has gone back up recently even though we reduced your medication earlier this year? He looked at me and smiled sheepishly. I think it was the holiday season. I ate saltier food and skipped a few of my morning walks. Just a few small habit changes and his blood pressure crept back up. We often underestimate the power of lifestyle. But I want you to imagine this. Every morning walk is a dose of medicine. Every time you add more vegetables and cut back on salt, you're adjusting your own blood pressure. Every hour of restful sleep is a natural healing remedy. Diet reduce salt. Read the labels on packaged foods. You'll be surprised by how much hidden sodium is inside. Focus on leafy greens, low-sugar fruits, fish and nuts. Limit processed foods, not because they're evil, but because they take away your control over what goes into your body. Movement you don't need to run, but a 30-minute walk each day, as consistent as taking medicine, can significantly lower your blood pressure. Stress management meditation, deep breathing, talking to a loved one. These aren't luxuries. They are emotional heart therapies. Sleep, a full restful night's sleep, doesn't just restore your body, it also naturally helps regulate blood pressure overnight. You see, the amazing thing is your blood pressure isn't beyond your control. Medication can help, yes, but it can't replace the things only you can do for yourself. I had a patient, her name is Joanne, 71 years old. At first, she was on 2 blood pressure medications daily, but after 8 months of committed walking, cutting down on salt, doing yoga at home, and sleeping regularly, she slowly reduced her meds. Today, she only takes 1 light pill at night. She told me, Doctor, I feel young again. Not because I'm cured, but because I feel like I'm in control. My dear friend, after 60, some things can't be reversed like gray hair or wrinkles. But your blood pressure, that's still within your hands. As long as you don't hand over your health entirely to a pill, hand it over to awareness, persistence, and self-love each and every day. And if what I've shared today helped you feel calmer about your own blood pressure, leave a comment saying, I'm starting again today. At this age, we don't need to race against time. We just need to walk steadily, live slowly, and choose the right direction. Blood pressure is just a number. But behind that number is an entire lifestyle, a daily series of choices, what you eat, how you sleep, and whether you still cherish your body or not. Start today, one small step at a time, because your body is still listening.